The most rewarding part of my job as a family physician is definitely the relationships I get to build with people. So getting to know people over the course of years and decades, getting to know about their personal lives and their families, and seeing them have successes in their healthcare journey is the most rewarding part for me. My name is Ted Bowers. I'm a family medicine physician with Hamilton Health-Calhoun. So my wife and I are both originally from Blue Ridge, Georgia. We have two teenage children, a daughter and a son, who keep us very busy. Enjoy spending time with my family. Really enjoy anything that gets me outdoors. So I love to play golf, love to fish, hike, even do yard work if that gets me outside. I went to high school at Fannin County High School in Blue Ridge, and then did my undergrad at the University of Georgia, where I earned a degree in microbiology, and then medical school at the Medical College of Georgia in Augusta. And then I did my family medicine residency for 3 years at Regional Healthcare in Greenwood, South Carolina. Other than the 3-year stint in South Carolina, definitely a Georgia guy. So I don't know that I have a specific moment where I decided to become a physician. Both of my parents were in healthcare. My mom is a retired ICU nurse. My dad is a retired pharmacist, both hospital and retail pharmacy. So growing up, a lot of the conversations around the dinner table at night kind of centered around healthcare and healthcare issues. As I went through school, I was really drawn to the sciences and really enjoyed problem solving and analyzing things. So medicine felt like a natural fit. So when I started medical school, I was really thinking about a lot of different specialties. As I progressed through rotations and training, I found that I was really drawn to the rotations where I could spend more time with patients, more face time with patients. And you don't have that in every specialty. And I especially enjoyed the ones where I could see how the patients progress through their treatment. Primary care, family medicine really gave me a good opportunity to spend time with patients and get to know my patients on a long-term basis and see a lot of different types of problems in patients of different ages. I've had, some patients that I've been seeing for almost 20 years now. So, and you really get to know people on a personal level and develop a great connection with them. It's really hard to completely understand what a new mom's going through until you see your wife go through it. So I do think, despite having excellent training, having children made me a better physician, being able to see that firsthand and experience the fear when your child's sick, and it's unnerving. So yeah, I mean, I think that certainly helped, if not from a knowledge standpoint, definitely from an empathy standpoint. I think a common misconception about primary care that I've heard a lot through the years is that patients have told me, I didn't feel like I needed a doctor because I wasn't sick. I think everyone can benefit from an ongoing relationship with a primary care physician who knows them well and who they trust. So when problems do arise, it's really a lot easier to quickly and effectively formulate a plan of care when you know a patient's history. On the flip side of that, I think it's helps the patient to be able to accept and start a treatment plan if they trust the physician who's giving that to them. So I think that ongoing relationship is very important. We don't have to wait until we're sick to have a relationship with a physician. I think it's critical to be a good listener and really hear what the patient's concerns are so that you can address those concerns and formulate a good plan of care. I think it's difficult to do my job without having empathy for my patients. When a patient comes to see me, they can expect that I will take the time to get to know them, that I will listen to their concerns, that I will provide professional care that is based on sound research and data, and that I will give them consistent quality care.